Yeah, I'll check. Yes?
I'm ready when you are. Where's Jimmy Ward? Anybody?
We're trying to help him get in. He says that he's
All right, trick question. How many times have we done this, everybody?
48.
We have a winner. Six.
Has it been that many?
Yes. All right, we see Jimmy Ward now. You just yell at me, Desiree, when you're ready.
Mayor, we are ready. Dr. O'Brien has not yet joined the meeting, but as soon as
Okay.
he does, I will let you know.
All right, thank
Or
you.
do you want to wait a few minutes to give him some time, or you may start the meeting?
We could probably get started and hopefully he'll be in by that time.
Okay,
Okay. This is our Isle of Palm Special City Council meeting, Tuesday, approximately 6 p.m., April the 28th. This is our virtual meeting. We think it's number 6. And I can call this meeting to order and acknowledge both the press and the public were duly notified of this meeting in accordance with the Freedom of Information Act. If our city clerk, Nicole, would call roll call, please.
Happy to do so. I think some people are still on mute. So Councilmember Ward. Councilmember Ward,
Yes.
here.
Here.
Councilmember Moy,
Here.
Councilmember Buchanan,
Here.
Councilmember Smith,
Here.
Councilmember Streetman,
Here.
Councilmember Pounds,
Here.
Councilmember Bell,
Here.
Councilmember Popson,
Here.
Mayor Carroll.
Yeah.
You have a quorum.
Okay, thank you. Okay, I think what we're going to do is probably ask for somebody to format our agenda and tackle the phased opening last. Do I hear a motion to reorder the agenda?
So moved. Second.
Second.
Who wanted to second?
Streetman.
Thank you.
Thank you. Any discussion? Hearing none, all in favor, signify by saying aye.
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 Okay, I think the ayes have it. Consideration of amendments to emergency ordinances 2020-01, 2020-02 to implement further measures to protect the citizens of the Isle of Palms, including but not limited to extending the access restrictions and the prohibition of future check-ins for short-term rentals, hotels, and other accommodations, and other measures proposed for the safety and the public health of the city of Isle of Palms. I do believe we need our doctor before we get into heavy discussions. Can we have a nod of heads for agreement?
Would you like me to do a roll call for that? Not
Yes,
really a vote.
roll call, yes. please.
Okay. Councilmember Ward.
Wait,
There was no motion.
There's no motion, there's not a vote. He's asking for just everybody's agreement on whether or not they want to wait for Dr. O'Brien before beginning the discussion on emergency ordinance.
could
I'd
we-
actually, sorry,
Go Oh,
Mm-hmm.
I was just going to suggest that we hear from our administrator on the topic before Dr. O'Brien joins us.
Well, why not? Desiree?
Sure. Dr. O'Brien has still not joined the meeting, but the ordinance that you all have in front of you is to consider extending the state of emergency. Currently, the emergency ordinance 2020-01, which was approved back in March, included some provisions that will expire automatically within 60 days, not including the checkpoints and the other restrictions, but the ability for city council to hold special meetings electronically would expire at the end of May. So we've included that in the red line for this amendment so that the ability to have virtual meetings could be extended as long as the state of emergency is in place. Also, the exception for businesses to be able to use plastic containers throughout the state of emergency would also expire in mid-May. And it's been included in this red line to allow businesses to use alternative containers that may be plastic through the state of emergency as well. The additional provisions that I think that the conversation would be focused in this evening is section 7 and section 8 and 9, which relate to the current access restrictions. Those are in place and expire on the 30th of April 30th, as well as the restrictions on short-term rentals. So that is up for consideration and discussion for City Council tonight. And Dr. Edward O'Brien has just joined us.
Okay. Dr. O'Brien, you with us? Welcome again to number 6. We appreciate it. Dr. O'Brien, what we're going to do is if you would kind of give us an update on where we stand medically with the hospitals and what MUSCC is going on around Charleston and the Low Country in South Carolina.
Dr. O'Brien, can you hear us?
The Zoom is not showing his audio is connected. So I would guess no.
John, can you text him?
I'm communicating with him.
Okay, thank you.
Yes, I can hear you now.
Thank you. Dr. Bryan, again, thank you. This is you're critical to our decisions, and we appreciate you participating with this for the 6th time now. So again, we're greatly appreciative. Could you give us an update on where we stand with the Medical University of South Carolina, the Low Country, and South Carolina in general?
Well, I'm sure you've seen there's been there was a relatively large increase in cases 2 days ago, but that was due to a reporting error. Not a reporting error, but some cases, about 44 cases got clumped. So it looks like we're still getting around that 100 or so cases per day adding. And as you know, today there were a bit of an increased number of deaths, unfortunately, with about 15 at last report. 24 hours ago, we are continuing to see a % of positive cases in the Charleston area, in our lab, in our Charleston lab specifically, still hovering around that 6.2% range, which is not really much of a decrease over the past about month or so in overall positive cases. Our hospitals continue to be able to handle any volumes that may come at this time. We feel like we have been able to handle, I guess, if you want to call it a surge or whatever, we feel good medically to be able to handle any of those kind of cases at this point.
Tonight, we're going to go in reverse order to make it fair for everybody for questions from our council members. Councilmember Ward, do you have any questions for Dr. O'Brien?
Yes, I do. Thank you very much, Mr. Mayor. Thank you for being here, Dr. O'Brien. We really appreciate it. I just have one question, and we're all watching the news very closely, and some reports I've seen cite the possibility or strong possibility of resurgence of the virus in states that are opening too soon. It's kind of a tough question for you here, but do you have any recommendations for us to know when it is time to start loosening restrictions? And what data would you like to see, especially given the age demographics of our residents? We have a lot of residents over age 65.
Right. I think that's a good question. I think the two things I would like to see are, number one, a consistent drop in the overall number of cases for our area over a prolonged period of time, roughly 14 days, which is the longer incubation period of the disease. The second thing I think is important to see is some sort of mass testing or larger scale testing being rolled out into our community, whether it's antibody or PCR testing for active disease. That's something that we could do for Isle Palms kind of as a municipality. It would be nice to see something like that before you do a larger scale open up.
Very good. Thank you, sir. That's all I had, Mayor.
Councilmember Streetman.
Yes, thank you, Mayor. And Dr. O'Brien, good hearing from you again. Really not a lot of new questions to ask. I just, in regards to some of the DHEC reporting we've been getting, it looks like, we're kind of on a plateau in South Carolina, but we still haven't had a steady decrease like we'd like to see. So is it your professional opinion, based on the guidelines that was put out by the White House, that we're in South Carolina right now, and particularly the Charleston area, would be in a phase 1 area comfortably, or are we still working towards that?
Well, I think the phase 1, is multiple components of the phase 1. I think we are approaching it. The component we don't have in phase 1 completely yet is quite enough mass testing. For example, we're working to get more testing in some of our lower socioeconomic places, people who don't have cars and who may not have internet access and things like that, who may be working on your island, for example, who may be taking public transportation and things like that. So I think we're approaching that, I hope that social distancing has caused a plateau in new cases, which is, as you pointed out, I think is important to see. So I would look to a state like a California, and I don't, to what they're doing now, which is interesting to me because they've had a relatively good plateau and a lower overall number of cases than other states. And even they don't feel like, and more testing, but even they don't feel like they're ready for a complete or even partial reopening yet, which is interesting. I would have thought they would have been one of the first. So I think we are approaching that phase 1 level you're talking about. I don't think we're 100% there yet.
Okay, thank you. One other question I have. I heard this on some program recently, but there was a doctor that was talking about the patients that have COVID-19 and how all of them that he had seen so far exhibited different symptoms at different times, and that it made it a very difficult disease to treat. Have you seen that? Is it something that varies so greatly between individuals that that each person that has it has a very specific treatment plan that has to be followed, rather than what would be sort of a normal protocol for a virus?
I think that's a good point, and I think that's also what makes this tricky. And you're right. So So some people have this loss of sense of smell and taste you've heard about and really no other symptoms. Some people just have headaches. Other people have severe shortness of breath and end up in the ICU. And the spectrum of disease we're seeing from this, all the way from, critical care, needing a ventilator, all the way from totally asymptomatic. And we just know so little about it in that spectrum. So you're right. Each case has a pretty specific and has to be tailored to the patient, which is pretty interesting. I think there was a study done recently in the prison system in North Carolina where they tested, I think, 4,000 inmates and had 300 and something positive, and 98% of them were totally asymptomatic. So it's interesting. What does that mean? I don't know. Did they discount some symptoms? But you make a great point. It's incredibly varied.
Thank you, Doctor. That's all I had. Thank you, Mayor.
Yes, sir. Councilmember Smith. Councilmember Smith.
Thank you, Mr. Mayor, and thank you, Dr. O'Brien, again, for joining us. You've been a real trooper to spend this much time with us. You mentioned the testing, and would you have any recommendations for a municipality like ours and a situation like ours for how we could use testing to our advantage when it becomes available?
Yes, I would recommend testing all of your frontline workers on the Isle of Palms, all of your EMS, well, EMS is county, obviously, but all of your police, all of your municipal workers, everybody who's critical for infrastructure, and maybe even, the full-time residents of the island. I think we could get a plan in place to more mass test them kind of all at once. And the testing would be a combination of the antibody testing plus the PCR testing, depending upon if you're symptomatic or not.
Do you have any forecast on when that capacity could be available?
Oh, I think MUSC can make that capacity available whenever you want it.
Really? Okay. All right. That's great.
Oh yeah, we're ramping up big time. Yeah.
Oh,
yeah.
okay. Super. And would that be are you thinking about a ongoing testing, for example, at least of our municipal workers, our frontline public safety? How frequently would you want to test them?
I would want to test everybody to make sure nobody has the virus first, obviously those that are symptomatic and maybe even some that aren't, to get an idea. And then after that, what you could do is you could do a series of antibody testing to see if there'd been increment exposure. I don't think people recommend antibody testing as of now more frequently than every month or so.
Okay.
But we'll see what insurance covers also, because you don't want to don't want to get it something to be so expensive that it's not affordable either.
Right. Okay. Yeah, I guess that's something we'd have to look at with costs and everything. My other question is about, we were given some information from staff in advance of this that included a discussion of, or well, not discussion of the downward trajectory of influenza-like illnesses, and keyed in on that piece of information, not just COVID-like cases, and how the recommendation is to see a downward trajectory in that set of data as well. And that in the information they presented, it looked like on that, that South Carolina, it ranks pretty high compared to the rest of the country in that kind of activity level, focused on influenza-like illnesses. And if you could talk about that and whether that could be an indicator of COVID cases that are not being correctly reported. Does that make sense?
It does. Yeah. So the ILI index is something that the CDC uses every year to track influenza, because as you know, a lot of people who get the flu never get tested. But we can assume a certain % of ILI is flu. And the CDC this year has recently transitioned. Normally that would still be going on, but they've transitioned that ILI index over to a COVID ILI index, assuming that a large % of those influenza-like illnesses are in fact COVID and no longer flu.
Okay.
So I think that their thinking, at least early in the CDC, is this could serve as a somewhat good proxy for COVID.
Do you think that the fact that we rank high in that regard, at least according to this report that ended the week of April 11th, I mean, it looks like we're one of about 6 or 7 states that rank high in the high category for activity level, or the very, very high. What does that? I was surprised by that and concerned that maybe we're not getting the full report on, or a good picture of how many COVID cases we might have. Should I be concerned about
Sure.
that?
I mean, I think it's reasonable to use that as a proxy. Of course, a lot of ILI could potentially be affected now by people not seeking healthcare quite as much. So that's something to think about. But I think it's more likely than not a decent proxy will remain a decent proxy. I will say this: it needs to be compared to South Carolina's baseline, and our baseline is slightly higher than other states. I think our baseline is, I want to say 3%, but I'll have to look. But I do think it's a decent proxy.
And when you say 3% baseline, what exactly what statistic are you referring to?
Oh, the 3%, it's the ILI index. So it's basically the influenza-like index. It's what percent of all outpatient visits are for influenza-like illness as opposed to other things.
Okay. All right. Thank you very much. I appreciate that. I'm done. Thank you.
Thank you, ma'am. Councilmember Pounds.
Yep, thank you, Mayor. Dr. O'Brien, nice to see you again, or hear you again anyway. So thanks for joining us. A couple of quick questions. So your opening comments, about dropping cases and mass testing, and then you see DHEC comes out today and pushes out their, kind of acceptable date to start releasing or softening social distancing. You pick up 10 articles this week and you can get 10 different conclusions or paths. Just kind of compare what DHEC came out with today and just kind of your opening comments, if you don't mind, if you can.
Sure. I did not see DHEC's release today. What was the date that they put forward?
They pushed it out to June 13.
Okay. Yeah, a lot of the forecast models. Okay, so compared to my opening statement, I would say that we know social distancing is working. So hence the plateau as opposed to the very, very, very large spike. And that also makes sense with some of the models that have forecast our peak hospitalization rate in the past. I agree with the social distancing lasting until June. Now, whether it's June 1st or June 15th, I really can't make a comment on that. But the social distancing, I think, has probably been the most impactful thing that we've been able to do. So I didn't know they said the 13th, but I certainly think that's reasonable.
Yeah, and I guess when you think about your comment about social distancing, there's all shades of gray of what we're trying to decide to do, to open the island, to take down checkpoints, to rentals. I mean, it's all over the place. But your question or your comments just more generally around social distancing, right?
Correct.
And then, Dr. O'Brien, final question. I know we've asked you a ton of medical questions. We've asked you some business questions that are probably not quite so fair. But more of a personal question. When would you feel comfortable loading up the Woody wagon and coming to IOP for a family vacation?
That's a good question. Well, that's a great question. June for me would be probably a time when I'd like to look. Before I take my family anywhere or anything like that, I want to see a pretty significant drop in cases over a prolonged period of time, over 14 days at a minimum. And then I'd be comfortable taking my family somewhere like the Isle of Palms, but I would not take them out to, public restaurants or any of that kind of stuff, probably for quite a while longer. But I'm extra cautious.
Same here. Well, it was funny. I saw somebody, I think it was Mark Cuban, the owner of the Mavericks, today said his measuring stick is would I take my kids? Would I take them out to eat or on a vacation or something like that? And I think, and that's part of my reason for my question to you, it may not factor into decision-making, but it certainly comes from an educated viewpoint. So thank you for that. All right, Mayor, I'm good.
Well, thank you.
Thank you very much. Councilmember Popson.
Dr. O'Brien, It's been a really big help. Just couple quick questions. Obviously, we get the cases, we get the deaths, but I never see, or maybe I'm missing something or not digging deep enough, but what are the total recoveries that we've had in South Carolina from the virus case?
Sure. It depends on your overall thinking. If you DHEC estimates about 67% of total cases that are reported now, and let's say, I don't know what the number is today, call it 5,500. So you can estimate about 2/3 of those are probably recovered or in the very late stages of recovery. So that's a good thing. And then on top of that, most people would estimate that since we're not testing everyone, that those numbers are all I'll call them underinflated, I should say. So if some people estimate multiplying that by, say we tenfold more cases than we've been able to test for, might be reasonable. But again, the first thing about the estimates you have to say is that nobody has got that figured out. So no estimate is 100%. So if you estimate there are more cases out there, I'd estimate 66% or so are probably healing.
Gotcha. Second question, and I hope I pronounce this right, but what's your feeling on hydroxychloroquine? You get a lot of reports that that's helping. I don't want to call it a cure, but it's helping with people with the virus getting better. Do you have any opinion on whether that works or?
I would say the data on hydroxychloroquine is still coming in. There was some early anecdotal good data, I believe out of France and some other places. I have personally seen some pretty good data I shouldn't say data, I should see some pretty good results of some patients who I have seen have the drug. And then there was an article that came out, I believe maybe a week ago, that said hydroxychloroquine was not good because it caused all these issues. I think, taken with a grain of salt, that article was about critically ill patients receiving hydroxychloroquine. I imagine, I don't pure speculation, that hydroxychloroquine will have good use cases in certain populations of people. Maybe it's people who aren't quite as sick, or maybe it's better to keep people out of the hospital as opposed to treating them in the hospital or something like that. But hydroxychloroquine, famotidine, and remdesivir are the three drugs that are kind of being looked at most closely. And we need some good news, so I'm hopeful.
Thank you. Thank you so much. Thanks, Mr. Mayor. That's it for me.
Thank you, sir. Councilmember Moy.
Thank you, Mayor. Thank you as well, Dr. O'Brien. We're all incredibly grateful for all of the advice and information you've got to share. My first question is really just, can you hit the high points of what's changed since the last time we spoke a week ago?
Sure. I would say, if I'm being honest, I would call the week in between more of a plateau, more of a taking stock of where we are, and trying to make plans to move forward from here. I would say there's not been a lot of negative regression, and there's not been a wild leap in positive news either. I've been staying on top of it, so I haven't seen a lot of, there's bad news in certain places, like if you look at Singapore and Japan and places like that, they're having pretty big, I don't know if you call them resurgences or not, but a lot of other countries are leveling off. So I would say South Carolina kind of falls right in that fold.
Yep. That's the sense that I had, but your answer segs into the next question that I have, which is, I don't know if I'm in this boat by myself, but when I look at the charts of hitting peak and then dropping, it's almost like the expectation that I had was, okay, day after peak, we start dropping, and we've been in this plateau for what feels like months. I guess it's only been a week, but is this a long plateau? Does it seem long to the medical community as well?
I'll be honest with you, because I watch the news and things like that, I kind of had a similar feeling somewhere deep down in my gut, even though I knew the data wouldn't go there, is that, we've reached peak, so now it's time to get back to normal, But the truth is, if you look at all those projections, the left side of that curve is steep. The right side of that curve, no matter how you did with social distancing, whether you were perfect at it or whatever, is flatter looking. It's less steep. By that nature, that side of the curve that we're on now, in theory, will drag out for a prolonged period of time. So scientifically, it makes sense that things seem like they're moving in slow motion a little bit. And so, yeah, but I'm with you on that.
Mm-hmm. And your first response leads to my third and final question, which is related to a potential resurgence of the infection. For all accounts, from what we see in the data, it seems like we've peaked and we've plateaued, and the measures that we're currently taking, all of the social distancing, all of the restrictions in place in our state and our community, are in effect working. And it seems like, I guess my question is, have you seen reports either domestically or globally that you think are a good, use case for Isle of Palms in terms of making sure that we don't repeat the errors that others have from making a resurgence? So I'll ask the question a little bit more easy to answer. Number one, are there any communities that you've seen that you say this is actually a really good example of what could happen on Isle of Palms? And then number two, the second part would be, can you point to any specifics that they did that you think contributed to that resurgence?
Sure. I think you're seeing some, I don't know if we can call it resurgence or a still number of rising cases, even in South Carolina. MUSC has a hospital in Florence, as you probably know, Florence County, and they've actually had a little bit of an increase in cases recently. I'm sure it's been in the news already. And there's some argument whether or not we're sending some public health experts up there to look, but there's an argument about whether they used social distancing too quickly or never took social distancing seriously enough, or if just other factors are going on. So I think you see that even within the state. If you're looking for someone who's done it well, I probably would actually look to Isle of Palms and Sullivan's Island and maybe even Folly Beach, who's set up, who have the chance to have a relatively high level of control and isolation. Not isolation, but just kind of control about who's come in and out and, the scenarios. And I would look, if someone was asking me on a national level, I would probably look more this way to say, these are some good cases of how to keep it controlled. And I can make a comment later on about what I think needs to happen for opening up, but I think Isle of Palms has done a pretty good job so far.
Thank you. I'll hand the microphone off so my colleagues can ask you questions. Thanks a lot, Dr. O'Brien.
Thank you, John. Councilmember Buchanan.
Thanks, Mayor. Thanks again, Dr. O'Brien. You mentioned the fact that there was an increased number uptick in Greenville area. And my question comes down to what you had mentioned earlier, the ability to Isle of Palms perhaps could get some testing out here, test the residents, test the frontline staff as well. I mean, are we seeing an uptick in those areas because we're having an increase in number of testing or increase in number of facilities that are testing? And on that, is DHEC is doing the testing, but it's being administered by the swabs and everything by independent agencies or hospitals? That makes sense.
So the labs, there's two kinds of tests that are run. So it's been about 55,000 tests or so done in South Carolina so far, and with a population of around 5 million and some change. So obviously that's a very small percent. The argument that we're seeing more positive cases because we're doing more testing is a reasonable argument if our testing were more massive or more widespread. But as the prevalence of the disease goes down, your testing percent positives are going to go down. So even as testing 1 million people, in other words, if there's a 15% prevalence of a disease and you test 300,000 people, you're going to have more positives than if there's a 3% prevalence of a disease and you test 1 million.
Right.
So, that kind of is the argument there. And we don't know the answer to that 100%. But
Okay.
The second part of the question is, of the 55,000 tests we've done so far, there's basically two major lab categories. There's public labs and DHEC. So DHEC basically runs the public labs in the state.
Mhm.
They've done about, I want to say 13,000 of the tests. And then private labs have done the other, I don't know, 30,000. MUSC is actually considered a private lab for the state, even though we're a state entity. I don't know why particularly, but we've done just about as many tests as DHEC, about 14,000 as well. And then the rest of the tests, the other half or so, have been done by other private labs or hospital systems throughout the state.
Okay, thank you. And to follow up on that, I mean, we see these spikes, and what are we looking at for an increase in in retirement communities or nursing homes? Are we seeing an increased number of COVID deaths or COVID cases in those types of environments?
You know, there has been an increase in a couple of nursing. Right. There has been recently in a couple of nursing homes, and we don't know that it's the caregivers who are asymptomatic who are coming in and transmitting the disease, which is certainly a possibility. You know, or if, let me just say that's the most likely, obviously. And so, like I think there was in the paper yesterday or the day before, and we saw in Florence, there was, I think 40 people had it at a nursing home. That includes staff. And then same thing in, is it Goose Creek or Hanahan had a nursing home with quite a large number. And those kind of niduses or nodes are something that you'll see pop up from time to time that we need to make sure to get a hold of quickly. That can happen in a community. So in a small community, that same type thing can happen. All of a sudden, a great example is Albany, Georgia, where, you know, they basically, one person at least had the virus and was seen as kind of a super shedder and went to a funeral. And, you know, within about a month after that funeral, I think, I don't know how many people were dead, but quite a number of people are dead and quite a number were sick. Of the 90 people at the funeral, I think 60 ended up getting the virus, and it caused a massive outbreak there. So that's what you got to be on the lookout for, and make sure to get on top of those things incredibly fast, which is why testing is so important.
Thank you.
Okay, thank you, Ron. Councilmember Bell.
Thank you. And welcome back, number 6, I guess. You know, the question is basically, and by the way, the most encouraging thing was we potentially could have an availability of testing. But if you look at, you know, a relatively contained island population, and we all get tested and we have a result, we also have the uniqueness of any coastal community of a rapid influx of population, be that daily from changing who we allow onto the island. What would your concern level be? And assume we've all been tested, we've got numbers, we know where we're at, and the floodgates open. What does that do to your concern level for whether, you know, the basis for that testing really holds water? If it's asymptomatic people coming, and the next day that we've been tested, and on the next day we've been exposed, does that not render the test relatively ineffective because we won't know beyond that point in time? I hope I asked that the right way.
That makes sense. That's right. So your question essentially is, you know, does the test not represent just one point in time as opposed to some sort of, you know, right? That's true. There's two kinds of tests, and the PCR test, which is the one that shows that the virus is active in your body currently, you know, the one that's most common, the nasal swab, is, we know that is a point in time. Yes. And how long does that point in time entail? It could be, you could be infectious for 7 days, but we think, you know, 14 or more is probably common. That is true. The second test, the antibody test, which if you were to screen like a whole island, you'd probably get a combination of the two. It represents a longer period of time. That would be better to decide what your baseline prevalence of the disease is. And that's why you would repeat the test. So what you would do is you would test everybody in Isle of Palms, for example, with the antibody, all the residents. And then if you opened things up over time, say by August, things are totally humming like normal or whatever, you would continue to test the people every month for 6 or 7 or longer months and decide, well, over those last 6 months, were we exposed to the virus? How many of us developed antibodies who didn't have it before? How many of us got sick, you know? And so then you would have an idea of just how dangerous it's been. And if you see a really, really large uptick in the people on your island who live there who are getting sick all of a sudden and or developing antibodies, you may want to reassess short-term rentals or letting people in or put checkpoints back up or something like that. So I think it's valuable over time, but it represents a point in time.
So if I think I heard you correctly in the beginning, I'm not used to the reverse alphabet thing, but I was going to recommend that today anyway. If I think I heard you correctly in the beginning, the comment around testing was we would not do the antibody testing early, that would be a later stage testing. So the testing that we likely would be looking at is a point in time test, which when we give consideration to gradual changes, obviously over time, more people are going to build up antibodies. We still are only affected by point in time tests and subject to whatever decisions we make going forward in terms of a gradual easing back into relative normalcy, correct?
That may have come across a little bit wrong. I apologize for that. I would
me.
No, it's probably me. What I would recommend is a combination of the tests. And so in a simple way to say it, if you're symptomatic, you should get the PCR test, which is the point in time test. And symptoms can be very mild. They can just be runny nose. So if you're asymptomatic, we would recommend the antibody test to see if you've had exposure. And then people who were one-time symptomatic and who are become asymptomatic afterwards, assuming they were negative on the PCR test, could then get antibody testing as well.
Okay. Thank you. Mayor, I don't have further questions.
Thank you. Dr. O'Brien, thank you again. This is Jimmy Carroll speaking. We're here and we got two big questions tonight, and they have to do with day visitors and vacationers. And I understand, I think you're a beach person, if I'm not mistaken.
True.
So right now we are allowing day visitors to come up till 7 a.m. in the morning and then come back after 7 p.m. at night. There's been discussion of expanding that to later in the morning and a little earlier in the evening, say 8 a.m. as opposed to 7, and 5 p.m. as opposed to 7. The people are still coming. Is that few hours going to make that difference? What's your opinion on that?
I don't know the logistics of how many people would come during those hours. I guess you would have to figure out. I assume that's not peak hours. I assume peak hours are middle of the day.
That's right.
Oh, it is. Okay. I think if you let the people come, are they coming to the beach or are they just coming to visit people's homes, or what are they?
I would say sunrise and sunset, maybe a late afternoon surf session or early morning surf session or dog walking.
Understood. Right. Okay. Yeah, I mean, I think if people are coming, I think that's a logical step as to a gradual easing of restrictions. That seems like a logical next step to me. And then it's something you can obviously change rapidly, right? If you feel like it was a mistake, you can change it rapidly. So I think those are the kind of steps that are well thought through, smart, very incremental in nature, and have the ability to change rapidly. Those are the kind of smart steps in a gradual reopening that I think makes sense from a public health standpoint.
Thank you on that question. And the second one is, our island, our economy, our revenue has a lot to do with tourism. And, we've got a lot of vacation management companies out here who wants to open immediately. And here we are just plateauing right now. The governor has expanded his for another 2 weeks. Do you think if we were to open rentals, say the middle of May versus June 1st, would you bring your family or not? The asset tip.
I wouldn't before June. That's just a personal preference, but certainly it doesn't make sense to open while you're in a state of emergency. So I totally agree with that. I think, and that could get extended another 2 weeks. It's hard to say, but we haven't really reached that 14-day downward trend, and maybe we will starting in. It could start tomorrow and for 14 days, and then you may feel a little better about it, but certainly June 1st seems more reasonable. However, what I would do, and I'll just say this, just so we're not on the, it doesn't seem like an ultimatum or anything like that. I would say in the interim, it would make a lot of sense to partner up with someone like an MUSC who has a public health program or something like that, and really go business by business and rental company by rental company, and really try to make some changes that can be enforced, and some changes that will lead to increased safety when you do reopen. We've talked about some of those things I know in the past, but getting a public health expert in there, I mean, really every business needs their own Dr. Fauci, right? So you go in there and we could tell the restaurants exactly what to do, where to sit, how to have your servers act, who to get tested when. Do the same thing with the rental companies. Say, here, listen, here's the cleaners you need to use. Here's how long the house needs to stay dormant between renters, things like that. Then you can make a really educated and smart public health reopening. And that way, you're not just stalling, but you're taking the time, in this next month to really put a great plan in place.
Dr. O'Brien, that ends my questions, but we have several department heads online with us. And I'd really like to get their questions in there, like recreation, the police department, public works. They all, so I'm gonna let Norma Jean, Director of All Palms Recreation, have any questions for you. Norma Jean Page.
I guess, thank you.
Speak on mute.
And I have some, a proposal here tonight to try to phase in a little bit of recreation using our grounds. We have quite a bit of open grounds, but I think we could do a soft opening, not to the extent of Mount Pleasant. They went all out, but something that people can use some of those fields doing the social distancing. And I was just wondering if you feel like it would be safe for us to go ahead and try a little bit that on the grounds.
Yeah, I think you cut out for a second there, but I think you said you're thinking about opening some public works that are open field. Is that correct?
That's correct. We have two relatively large fields that we would split in half and let 3 people on either side at any given time. And then even we were thinking about the dog park, just allowing 3 people in at a time. Possibly the tennis courts for single play only. And every hour we would wipe down the fencing latches. So as people come and go, we can clean those and make sure that they're disinfected and sanitized.
I mean, I think that sounds very reasonable. If you can enforce that social distancing and enforce that, I think that's good. And there's new good evidence showing that UV light does kill the virus over a period of time. So I think that makes a lot of sense.
Okay. Thank you.
Thank you, Chief Cornett.
Sorry. Thank you. I don't have any questions. Thank you for all of your information and being available to all of us.
Thank you.
Thank you, Chief. Is Donnie with us or not?
He was.
Okay, Dr. Brian, just for our public works, they're out there every day, doing their jobs. Is there any suggestions for them? Besides what we're doing now and keeping our public works department, keeping our island clean?
I certainly would love to roll out some testing to the public works department. I think that would be great for them. But otherwise, just keeping them like the rest of us, using the proper personal protective equipment, I think is the best you can do. Everybody appreciates the public works still working through all this, of course. And so anything we can do to keep them healthy is important.
Okay. Last but certainly not least is my boss, Desiree.
Thank you, Mayor. And thank you, Dr. O'Brien. You've been tremendously helpful, and we certainly appreciate your time We have been in coordination in communication with Charleston County about performing some antibody testing to our first responders. So I'm glad that you are recommending that we pursue that. I do have a bunch of questions, logistical questions and operational questions about the rollout of massive testing on the island. And, you know, maybe you and I can have some time offline to discuss some of those, you know, before we move forward on that in terms of cost and how that would be reasonably rolled out in this community. But very hopeful and excited, I guess, at that possibility. I think that, you know, the main question we all have is, what is that trigger that we're looking for that would give people some comfort in starting to consider the lifting of restrictions? You know, we've talked about some of the guidelines from the White House and the recommendations from DHEC on a sustained downward trend on the number of new cases and significant contact tracing capabilities in the state, and increased capability for testing. What would be your recommendation? What is that data point that we should be looking at that could serve as a guiding point in for city councils to start considering lifting those restrictions?
Sure. I mean, I think the CDC and the White House / DHEC's recommendations are great. But you're right, it's a difficult. So what does that mean? You know, testing for everyone. What does that mean? Contact tracing. You know, what statistic can we look at to say we have a green light on that, right? So that's a great question. And it's a difficult one. So I would think that the first sign that you want to see in the state would be that downward trend in cases, despite our upregulation of testing. So when you see that, you know, you start to think, all right, we're within, you know, a couple cycles and cycle being 14 days of probably being able to loosen restrictions. So that's the first thing I would look for. And now we're at a plateau, right? So you guys are thinking in the right direction. That would be the first thing. The second thing, in order to give a green light or would be to enforce, to go ahead and have plans to enforce the requirements for phase 2, which are, you know, having the proper business plans. I know Charleston County had a great municipal statement. I'm sure you guys all read it, where it was talking about what they wanted their businesses to do if there's a reopening. So I think having a great plan would be the second light that I would look for. And then after that, I honestly would look to the public health officials in the state. Like even MUSC locally is obviously highly coordinated with DHEC, and to get real local data and to really narrow it and hammer it down to local. MUSC does that for our local community. Those are the three kind of lights I'd be looking for.
I have two follow-up questions. So when we're talking about a downward trend of new cases, does that mean every single day we see a downward, less and less numbers, or does that mean less numbers than the peak, where I think we were talking April 9th with 262 cases? So does that,
right,
is that what we're interpreting? Because we've been trying to get some guidance from DHEC, and I think it's a hard question to answer. Are we looking at, you know, less number of cases every single day consistently for 14 days? And if that's the case, then we haven't seen that yet, because like you said earlier, just 2 days ago, we had 200 new cases. Today we had 172. Back on April 20th, we had 62 new cases. So it kind of goes up and down every single day. And I don't know if that is as a result of a backlog in testing or what, but is that your interpretation when we talk about a downward trend on new cases?
Yeah, so it is. I think it's what you do is you have to average a certain number of days together because it's hard on a day by day. So you might average a 5-day trend over 14 days because there's going to be some peaks and valleys. Like that one day, that one lab in Greenville reported 40 cases, but those cases weren't new. They were from the whole month. They just reported them in one day. So you're right. It has to be a day-by-day number, just looking at it would be hard to do, but on the averages is the way to go. And Dr., I can tell you, we can bring a resource in from MUSC and to speak offline to your municipality by a great professor of epidemiology and public health at MUSC called Dr. Michael Sweat. And he can really nail down trends on a more local level by zip code. And that would really help us a lot. And also testing more would help us a lot in this area.
Okay, thank you. The other thing that I wanted to mention is that internally at staff level, we have been working on setting up a webinar type of discussion with our businesses here, particularly brick and mortar businesses. And we would be honored to have you in the panel along with other DHEC experts to provide some guidance on how our businesses can safely consider reopening as well, and provide some input that would help them increase the confidence in people that will be starting to visit their establishments in the future. So I just want to put a plug in, and I would appreciate if you would be available for that as well.
Sure, I'd love that.
Okay.
That's all for me, Mayor.
Thank you, Desiree. So I have a question for you and for Julia on our emergency ordinance 2020-04, which is inclusive of 01, 02, and 03. We basically have 3 changes. One is number 7 about the beach access in the mornings, 7 a.m. to 7 p.m. Should we go for the whole ordinance first and then do the amendments separately?
Mayor, I think you need an amendment to approve the proposed ordinance, and then during the discussion, you could certainly entertain amendments.
Okay, but again, during this whole ordinance, the amendments don't show dates in there and times in there. So those are the amendments we're going to be talking about after we get discussion going.
I would say so. Julia, do you have any thoughts on that?
Well, if we want to talk about each specific section and say, let's say if we start with number 7, someone make a motion to approve it with a certain date stated, and then we get a second for discussion, then people can make amendments if they want to change anything in the body of it. I think if we go by section, it might make it easier for us, you and me, Desiree, to keep track of what they're changing, and Nicole, of course.
Okay. Okay. So do I hear a motion on the emergency ordinance for the number 7, as for access to Isle Palms, the timeframes from 7 to 7? Any changes?
Mayor, I'll make that motion. Leave it at 7 to 7 through whatever the governor's date is, May 14th, 15th, whatever his extension was through.
Okay. Do we have a second?
So the date would be May 11th. Currently, that is the deadline for the governor's state of emergency.
We're talking about timeframes for coming onto the island up until a certain time, and then coming back on the island after a certain time.
Correct. I just wanted to clarify for the record, the last sentence of section 7, where it says access will be restricted subject to the above from 7 a.m. to 7 p.m. until we need to insert a date there.
May
Thank
11th.
I'll second.
Okay, we have a second. Discussion. All right, Councilman Smith.
I would recommend shifting it to allow more time for our neighbors to come visit the beach. I think we've all heard a great deal from them, and I think we can safely constrict that restricted time so that it's, to at least allow for 8 a.m. to 5 p.m. to give more people a chance to enjoy the health benefits of coming to the beach, as long as they are abiding by social distancing and staying in motion, as we've already outlined.
Is that in the form of a motion?
I'm not sure
Amendment
the best way. would it be to amend the motion then? Okay, I would ask for an amendment to the motion to allow for, to change the restricted access period to 8 a.m. to 5 p.m.
Do I hear a second?
I'll second for discussion, and if I may, keep holding the microphone, the proverbial microphone here, and start off the discussion. First of all, I don't think it's been said enough on the record that I know it's implicit, and I know that I don't speak for any fellow council members, but I know that you all feel the same as me, that we want our neighbors to enjoy the beach as much as possible, and we want short-term rentals to be open for as long as possible, as soon as possible. And, you know, I think it's really important that we keep saying that. And, you know, the policies that we are promoting and what we're trying to do, the decisions that we're trying to make are truly in the spirit of trying to make that happen. And our concerns are, in looking around at what's happened globally and domestically, is that if we make a poor decision today, that it means that we have to take tighter restrictions in the peak of summer. And so, you know, we want June and July and August to be times when, you know, obviously things aren't going to be like they were in 2019 out here, but that we have access for as many people as possible with the least amount of restrictions as possible. So I think it's just important that we keep restating that, and you know, to our neighbors throughout the community, we want you here, but we also want to make decisions that are going to allow the beaches to be open for as long as possible. So that's my first point. My question is really directed for the chief, first of all, because Chief Cornett, I feel so much for you and your team, and God knows I have not done enough to support y'all and give you praise and appreciation. But thank you, first and foremost, and my heartfelt thanks to your entire team. I can't imagine what it's like being out there day in and day out, and you know, having to turn folks away who do want to come out here.
Thank you. We appreciate that.
As we look at maybe making some gradual incremental changes to this ordinance, what is your reaction from an enforcement standpoint, but from two aspects? One is, if we reduce the time, that's obviously less time that you have to have a checkpoint. The other side of that double-edged sword is, well, now we have to have more enforcement on the beach. And I believe our keep it in motion should, my perspective, that will help, that makes enforcement easier on the beach. And it's one of the reasons why I would consider changing the hours, because we have the keep it in motion in place. And it's why I voted for keep it in motion in the first place, because I felt like it was part of our incremental phasing. What is your reaction to those two things, and you know, the feasibility of your staff to be able to accommodate a change like that right now?
So you're right in the fact that we would still have to make sure that we have staffing to patrol the beach. And we've already begun to adjust our personnel and their hours to make sure that we have a better presence on the beach. I know that was one of the concerns that came out of this past weekend. And so I'm happy to say that our team has been out there heavy today, and they've done a very good job, very thorough. With that, we would continue to do just that. The advantage to, if I looked at both of them, the advantage to me from the beach aspect as opposed to the checkpoint is, on the beach, we can simply ride by with our window and maintain distance outside of our car, and we can tell them, hey, keep moving. Whereas at the checkpoint, when they stop, they've had their windows rolled up as they came over the connector. They suddenly roll one window down, air comes in, and they're wanting to talk to officers and have a conversation with them. To me, it puts our officers at a greater risk doing the checkpoint than it does enforcing the keep moving. So I know it's probably not the popular vote with some of the other areas, but I think the safest thing for our officers is actually the enforcement of the keep moving.
And I'm sorry to take so much time, but just to reaffirm, in terms of your, what you expect in terms of volume during those times on the beach and your ability to enforce the keep it in motion, what concerns do you have there?
So staffing, of course, would be the concern, but we have 2 BSOs that have been on payroll that just have not been working during this time. They have indicated that they are ready to come back. One's coming back this weekend. One will be back on Monday. And so we will be able to, that gives us 2 extra bodies to help enforce during that time, both the parking and the keep moving on the beach. Because to be 100% honest, we're going to be inundated with people the moment we say you can come. And so we're going to have to make sure that we're enforcing parking as well as the restrictions that are on the beach for keep moving. I think we'll have the personnel and we'll adjust schedules to be able to do that in the best way possible.
Yes, sir.
So, we spent an hour listening to Dr. O'Brien, whom I truly appreciate, talking about increased populations, Chief Cornett, and thank you. And by the way, I wouldn't want to stand out there all day either. Truly appreciate it. We still have a shelter in place order from the governor. We've got all the medical data telling us that we should, frankly, be as restrictive as we can. Yet we debate increasing hours and understanding we're going to be inundated, right? So, I echo Councilmember Moy's comments about welcoming our neighbors, but first and foremost is protecting the island and the residents and acting in accordance with the governor's order, which says shelter in place. It doesn't say everybody should, choose to maintain a normal lifestyle and do whatever they want to do. It just seems to me that our responsibilities should be directed towards the population of this island, which we do talk about being an aged population. Shelter in place is shelter in place. So when we look at the dates that we're looking at and changing these times, we're coincident with the governor's directive to shelter in place. At the same time, we're discussing loosening restrictions and inviting people that are supposed to be sheltering in place onto the island. I'm sorry, but it just simply does not make any sense to me. And we all talk about, if it's working, don't change it. What we're doing is working. And, this feels like a ball game where you're in the 9th inning, you decide, I'm just going to give the game up by making a change. It doesn't make any sense. We ought to at least stay the course through May 12th.
Any other discussion? Councilman Buchanan.
Perfect. Thanks, Mr. Mayor. And I appreciate the chief and all the work that the officers have done. I know they're exhausted and they're tired and the overtime that they've done. But and to go on what Councilman Bella mentioned, and what our primary goal is, I remember taking an oath. I got it here in front of us, and it basically says, according to the Constitution, we are duly qualified, according to the Constitution of this state, to exercise duties of the office of the Constitution of this state and of the United States. And that's one of the things we have to work on. Here's the South Carolina state Constitution. Here's my other one, federal Constitution. So we need to look at that as well. We need to look at the timeframes. We cannot continue to restrict people, because even though there's a governor's order to stay at home, it doesn't. It expands it to exercise. So people need to exercise, whether it's riding a bicycle across the bridge, for God's sakes, or running across the bridge. We cannot continue to stop these people from coming. If they're exercising, they're staying in motion. We have our residents on the island staying in motion on the beach, but we can't have people who have every right to be on the road. We're stopping them from staying in motion. We have to find a way to make this thing work for them. What is the time? What is the dates going to be? I still think the 8 to 5 is still restricted. We need to make ways that our businesses are suffering. They're trying to open up. We have a restaurant opening up tomorrow. We have another restaurant open up on Friday. We had one that just opened up this weekend, but they're only open up for the weekends because they cannot sustain what just on the residents alone. They need additional income. They need additional help. And as long as they're maintaining the state, I mean, it's maintaining their social distancing and doing takeout only, I don't have a problem with that. But we just need, and like, as the chief said, it will be easier to enforce the stay in motion on the beach than right now than it is to enforce this check.
Thank you. Councilman Streetman.
Yes, thank you, Mr. Mayor. Yesterday, you know, when this question was first posed a little bit to each of us to just kind of ponder a little bit what the restrictions might be and opening up the island, and I certainly, you know, have been telling myself all along, I'm in favor of having a less restrictive situation so that more of our neighbors can come to the beach. And I'm not particularly in favor of an 8 o'clock. I was thinking that maybe 7 o'clock would leave that in place because of contractors that come over to the island who can't go to work out here before 8. If we had 8 o'clock in place, some of the unlicensed contractors may come over early and just hang out. Goodness knows what happens then. But I also yesterday was thinking about it, said, you know, 5 o'clock would probably be a good compromise also. But I got to tell you, after thinking through all of that, and then with what the governor came out with and extending the stay for another 2 weeks, I'm in the camp that right now we leave it at 7 to 7 up until May the 11th or 12th, whatever that date is, and reconsider. And if something happens between now and then, I mean, we can always reconvene as we are wont to do, and change that. So my thoughts are that we leave it just the way it is for now. Thank you.
Any other conversation? I would like to say a couple things. Listening to the doctor and talking about the few expanded hours and how it's healthy for us, I took that as a positive. So sound medical advice is what we've been going on for a while. And baby steps. I love baby steps and getting started, but that's the end of my remarks. Is there anything else before we vote on the amendment? Hearing none, we're going to do a roll call vote.
Mayor?
The first one will be for the amendment of 8 to 5.
Actually, the motion was to keep it at 7 and 7.
But then we had an amendment.
That's the motion.
Yeah, that was the motion, but then we had an amendment to the amendment.
And then, right. And then to keep it then to move it 8 to 5. That was the motion to amend that 8 to 5, but also through May 11th.
Yes,
just one thing, Mayor, if I may.
yes, of course.
We may want to, maybe City Council would consider May 12th with the
Day after.
expectation of the governor making an announcement on May 11th. It would give the city at least a day to consider any changes. So I would just recommend that as part of the motion.
That was made, that the 8 to 5, and then that the first original amendment was done by Councilmember Pounds and Councilmember Bell for 7 to 7 through 5:11.
Yes, yeah.
Are they open to a friendly amendment to keep it to change it to 5:12?
Yes.
Yes.
All right, thank you.
What about
Okay.
Councilmember Bell, who
No.
seconded the motion?
You are not open to a friendly amendment for 5:12?
No.
The day after the
No,
governor.
well, let me clarify. I'm not open to supporting changing the time, so I'm not sure where we are and how we word this.
The
We're just
original
asking about
motion-
the end date right now, Randy. of
Oh,
May
no,
12th.
the end date, I'm fine with the end date to.
All right.
Okay.
Okay, so we're going to vote on Mr. Moore.
Sorry, I just wanted to make one more comment. At the risk of restating things that have already been said, from what I've heard and what I've gathered from again our medical advisor, but also from the data that we're seeing coming in from the different sources, from DHEC, from MUSC, and from national bodies. We know that we're at a plateau, so we're not at the downward. But in this case, we have some new ordinances that we didn't have when we initially set the 7 to 7, which is the keep it in motion. And that's one of the big changes for me. And hearing from the chief, if he had any concerns about enforceability, that would have certainly skewed my position. But what I'm hearing from him is the enforceability of this is better for our public safety in terms of keeping them safe and keeping them at work. And at the end of the day, what's the purpose of the access restrictions? It's to make sure that we're not inundating the beaches with massive pockets of people who are hanging out, clustering with people that aren't in quarantine with them, whether they're family members or whomever. And by incrementally taking baby steps, as the mayor put it, we're giving ourselves a chance to see data emerge. And so I think it's the right move for us to say, we told at the very beginning, we've been saying all along, we want to do incremental steps towards phasing out some of these restrictions. And while the emergency order stays in place, that doesn't mean that we can't start taking smart incremental steps on the advice of our public safety and our medical advisors. So that's my final comment.
Thank you. Administrator Fragasso?
Yes, one thing to consider I don't think we've talked about it yet, but the town of Sullivan's Island had a meeting this morning, and they're maintaining their checkpoints 7 a.m. to 7 p.m. through May 12th. So unless they change those hours, the city's police department would have to implement a checkpoint. I think, well, they will have to implement the checkpoint at Breach Inlet. I just wanted to make sure that y'all were aware of that as part of your discussion as well.
Councilmember Smith?
I'm confused by that. If Sullivan's has more restrictive hours, it would seem to be, I don't understand why we would need a check. If they're checking starting earlier than we would be checking, I don't understand why we would need a checkpoint at Breach Inlet.
I was referring to them. They would need an
they
additional
would need.
checkpoint. Yes.
Oh, okay.
Not the city.
Okay. Thank you.
Okay. Any other questions or discussion? All those in favor of the amendment starting at ending at 8 o'clock for people coming in the morning.
May I ask the question? I raised my hand. I was on mute.
I'm sorry, I didn't see you.
So in the event that Sullivan's does not agree, which is a possibility, particularly, changing both the morning hours and the evening hours, we should be cognizant of it is going to cause us to put a checkpoint at Breach Inlet, right? So in terms of the chief's comments, which I do respect and appreciate.
Chief?
If the hours aren't coincident in both communities, then you're going to have to go back and rethink this same discussion. So to Councilman Streetman's comments about the morning, they would have to change their morning hour to 8 o'clock and their evening hour as well. And if we don't have both communities totally aligned, does it not necessitate another checkpoint?
It would necessitate a checkpoint for them to do one at Breach Inlet. And that is difficult for them to do. They are a smaller police department, but they would have to have one at Breach Inlet, not us, but they would have to have one from 7 to 8 and then from 5 to 7 in the evening.
Right.
And of course, if that was a decision, I would do everything I could to help our neighbors out.
Here we go.
And I will say that their motion this morning did include a contingency clause, depending on what City Council or the Isle of Palm City Council decided tonight. So I think that they seem to indicate that they would be open to reconvening should Isle of Palm's City Council made any changes to the checkpoint hours.
So just for everybody's purpose, I sent it to everybody. Someone said under G, access will be restricted subject to the above from 7 a.m. to 7 p.m. unless otherwise agreed upon by the town council in order operational consistency with the Isle of Palms. So again, I think they're going to watch what we do here. Any other discussion? Hearing none, all those in favor of 8 to 5
Councilmember Popson,
Aye.
Councilmember Pounds,
Nay.
Councilmember Streetman,
Nay.
Councilmember Smith,
Aye.
Councilmember Moy,
Aye.
Councilmember Ward,
Aye.
Councilmember Buchanan,
Aye.
Councilmember Bell,
Nay.
Mayor Carroll.
Aye.
The motion passes 6-3.
Thank you very much. Desiree, we don't have to go back to the original motion now, do we not?
Yes.
Because of the date, right?
Because-
Yes, so
All right, going back to the original motion because of the date, which is the 12th.
correct. So the original motion as amended would be section 7 of the proposed red line. But there would be changes to the last sentence of that section where it would say access will be restricted subject to the above 8 a.m. to 5 p.m. until May 12th.
Got you.
And I do have just one item for consideration. It was an oversight from our end, where we start listing the criteria for access. I would like for the city council to consider an amendment to include property owners with proof of ownership. Currently, we only have residents with proof of residency, but we have not been restricting access. I think the intent was to allow property owners who own a property here to be able to come through the checkpoint during those times. So I would ask that you all entertain that as part of as an amendment.
I'll make a motion to make that amendment for property owners that have access.
Do I hear a second?
Second.
Second.
Okay. Nicole?
Let me just write it down real quick.
Okay. I'm sorry.
Okay. Councilmember Bell,
Aye.
Councilmember Buchanan,
Aye.
Councilmember Ward,
Aye.
Councilmember Moy,
Aye.
Councilmember Smith,
Aye.
Councilmember Streetman,
Aye.
Councilmember Pounds,
Aye.
Councilmember Popson,
Aye.
Mayor Carroll.
Aye.
All in favor, the motion passes.
Unanimous. Thank you very much. Number 8, rental and use of.
Wait,
short-term-
Mr. Mayor,
Yes,
Mr. Mayor, we
sir.
still have the main motion on the table.
Yes.
The motion to amend all of section 7 with all of those to 8 to 5 and allowing property owners with proper proof through May.
Ron, you making that motion?
No, Mr. Mayor, I'd like to make an amendment to that motion to allow those on bicycles and runners to cross the bridge because they are exercising as per the governor's mandate.
Let's second that.
Okay, discussion.
I have a question. If the intent is to allow them to just go over the connector from Mount Pleasant to the checkpoint, to the end of the connector on the Isle of Palm side, or to then allow for exercise to continue on the island even between the restricted period. Does that make sense?
Yes. If they are running or riding their bike, then they can continue to ride on the state highway.
Any other discussion?
Wouldn't mind hearing from the chief around that.
Can I ask procedural question first?
Why,
So
sir?
if we combine I mean, obviously the intent was property owners. We've never passed anything that disallowed property owners on the island, but combining this in a singular vote, do we have to have the amendment for property owners, since that feels to me like it was a wording issue. We were very explicit in the prior meetings around residents, property owners, anyone with proof of property ownership. So I look at this and I go, clearly I will not vote for the 8 to 5. Clearly I do support property owners coming onto the island, but we're combining it in section 7 with a singular vote. It made a Julia question.
Randy, we're talking about exercisers.
I'm Ryan has offered an amendment. I still have a question on the overall section 7. That when we change the wording, to me, I don't think, and it's procedural, do we have to, can we not just change the wording back to what we've previously passed? I mean, we're not changing anything. Property owners have always been allowed to come on the island since the beginning on March 26th.
Julia.
So Julia just dropped. She's going to try to join the call again. I'll admit it to her quickly. I'm not sure. I mean, a vote has already been taken on that amendment.
You'd have to have a motion to recall.
Never, then drop it, forget it.
Yeah, it'd have to, a motion to reconsider, and it would have to be made by somebody who voted in the.
Reconsider.
Yeah.
Okay, moving on. Number 8, rental and use of short-term rentals,
We
hotels.
still need to,
Oh, Mayor, we got to vote.
You have a motion on the floor about allowing bikers and runners?
Oh, I'm sorry.
And I want to hear from the chief around this.
There he is. I'm looking for him.
Hey, so my only concern with the cyclists and the runners would be that we would have to have language in there that gives us the ability to differentiate between a cyclist who is riding for exercise versus a cyclist who just happens to get on a bicycle and is towing their beach going stuff behind them. And then we get into a gray area of how do we know that they're going to come over and just ride? Typically, we would say the people who are dressed in the typical cyclist athletic wear would be somebody that we know and could say is just coming to ride for exercise. But we would just want to make sure that if we just say cyclists across the board, understand that that's everybody on a bicycle that comes through, unless we articulate it in a different manner.
Julia, did you hear that?
Sadly, no, my internet dropped and I fell off the meeting for a moment.
The question was about cyclists coming across.
Right.
And the police differentiating between a cyclist pulling a wagon with beach chairs and coolers versus one who's on a bicycle with nothing else, or a bicyclist who is in riding gear. We don't want to make our police department get closer to people. So I'm not sure, how do we differentiate that from a casual cyclist versus with nothing versus a cyclist who's got beach towels in the back of the bike? Is that, Chief, am I proper in saying that?
Pretty much. It's really, we just need to make sure that the language is there because we understand cyclists who are in athletic gear and dressed as a typical cyclist doing the bike riding for exercise. But if we don't have the language in there and we just said cyclists were allowed on, then that would be anybody who's on a bicycle could come through.
Ryan,
what?
we're going to meet again next week. We know that. Do you think we can come up with language between now and next week to accommodate that? Or do you want to tackle this tonight?
Well, here's the thing. We're already not allowing coolers and chairs on the beach.
Right.
So for somebody who's coming over with a cooler and a wagon and chairs, well, then yes, you can either make them leave it there or turn around. But I'm saying it's just for exercising purposes. Is if people's riding their bike or they're trying to get out and exercise, running, it doesn't make sense. It's just overreaching. There's so much overreaching going on here. It's getting to be a little ridiculous.
It is definitely easier from the police side to just let them come through. Just wanted to make sure that everybody understood that if we say cyclist and runner, that's everybody that's on a bicycle, that's everybody that's on foot that comes through there. We're going to let them through.
Perfect. That's the motion.
I have a point of clarification, Mayor.
Yes, ma'am.
It was mentioned earlier that the emergency ordinance 2020-03 prohibited coolers and chairs, and that language is not included in the ordinance.
Right.
What's prohibited is sitting in chairs, sunbathing, loitering, and congregations of more than 3 people.
Okay. Council Member Smith.
I would just say that while I understand the intent and I have nothing against bicyclists and runners. It sounds like that could be a gray area that would be problematic. And so for that reason, I would not support the amendment.
Okay. Anyone else? Okay, all of those in favor of the amendment to allow bicyclists, cyclists, and runners to come across the bridge at all times. Let's have a roll call vote.
Councilmember, Councilmember Bell, your vote?
No.
Are you, no? Okay. Councilmember Buchanan?
Aye.
Councilmember Ward?
Aye.
Councilmember Moy?
Nay.
Councilmember Smith?
Nay.
Councilmember Streetman?
Nay.
Nay.
Yes, nay.
Thank you. Councilmember Pounds?
Nay.
Councilmember Popson?
Aye.
Mayor Carroll?
Aye.
The motion does not pass. Four in favor, 5 opposed.
Okay, thank you very much. Moving on.
The main motion.
That's right. We need to vote on the main motion.
Would you reread the main motion, please? I'm sorry.
The main motion is going to be to adjust the, hold on. I forgot. Okay.
I got it when it
So just think about public
I
watching
gotta
this.
go back and look at the votes. That's what's getting me. Is that not changing the times from 8 a.m. to 5 p.m. and moving that to May 12th.
Mhm.
And then we also had the property owners amendment as well to allow them to cross with proper proof of ownership.
Oh, there you go.
Yep, that's
Okay.
it.
Okay.
Roll call.
Councilmember Popson,
Aye.
Councilmember Pounds,
Aye.
Councilmember Streetman,
Aye.
Councilmember Smith,
Aye.
Councilmember Moy,
Aye.
Councilmember Ward,
Aye.
Councilmember Buchanan,
Aye.
Councilmember Bell,
Aye.
Mayor Carroll.
Aye.
Motion passes unanimously.
Thank you.
All right.
Just, Mayor, if I may.
Yes, ma'am, of course.
So these changes would go into effect May 1st, because currently the existing ordinance, emergency ordinance 01 and 02 are valid through April 30th. So
Yes,
these
ma'am.
changes would be implemented on May 1st.
Thank you very much for clarification. Moving on, number 8, rental and use of short-term rentals, hotels, and other overnight accommodations for 29 days or less, beginning 10 a.m. Thursday, March 26, 2020 through May whatever 2020 shall be prohibited. Visitors currently checked in may remain until the end of the existing reservations. Do I hear any motion for changes to dates?
Mayor, I'd make a motion to make it consistent with item 7, May 12th.
Second.
Okay, discussion.
Mr. Mayor,
Yes, sir.
at this time, I'm going to go ahead and recuse myself from the discussion because of conflict. And I'll file my recusal form with city administrator and attorney. I'm going to step away from here for right now.
Okay, thank you very much.
Mayor?
Yes, sir.
Yeah, just, this one's complicated. I just want to offer some commentary on it. I inquired of the chief and of Desiree, where are we at in terms of, and chief, please correct me if I'm wrong on the totals, but we've had 4 complaints today on short-term rentals. 2 were unfounded, 1 was cited, and 1 is pending. So the reality is, whatever we do or whatever we choose to do as a council, we're a bit delusional if we think, we're having a real impact on the rentals. I've had more personally than 4 complaints. I think most of us have. So, if you look overall, what we're asking to do, I think from the governor's order on down, we're not in a position as a city to enforce a quarantine on a tri-state area. We're not in the position as a city to legislate to the rental companies what their contracts look like. So the reality is they can go forward with a 31-day contract with whatever cancellation clauses and continue to operate as my personal belief, many of them are. So I'm not, the dates themselves, all medical advice says we shouldn't do this. So if we want to rely on medical advice, we shouldn't do it. But all I'm offering to council is the reality of where we are and recognizing we should at least remain consistent with the governor, but recognize also that we can't put this burden on the public safety people and expect that we're actually going to affect any change through this, because we simply haven't been, and we're not willing to do so unless we're willing to suspend licenses on citation, which we probably are not willing to do. And I'll leave it.
Mayor, excuse me, Randy.
That's fine, Jim.
Councilman
Mr.
Ward.
Mayor,
Yes, sir.
I'd like to call on City Administrator at this time to discuss something we were talking about this afternoon in her office pertaining to this. Desiree?
Yes, thank you, Councilmember Ward. I did have a question that I wanted to make to the city attorney. According to Governor McMaster's Executive Order 2020-19, which implemented prohibitions throughout the state of South Carolina on making, and I'm going to read this verbatim from the executive order, so please indulge me. It says, prohibited from making or accepting new reservations or bookings from or for individuals residing in or traveling from any country, state, municipality, or other geographic area subject to or identified in a CDC travel advisory or other CDC notice as a location with extensive community transmission of COVID-19, to include the tri-state area consisting of the states of New York, New Jersey, and Connecticut. When you go to the CDC's website, they establish 3 different levels of advisories for worldwide. Level 1, it's limited community transmission. Level 2 is ongoing community transmission. And level 3, which is the highest level of a travel notice, is widespread community transmission. And they split that between those countries that have current restrictions and travel restrictions in place, including China, most European countries, the United Kingdom, and Ireland. The whole world is under a level 3 widespread community transmission. So it looks to me that whether or not the city of Isle of Palm City Council lifts any restrictions on short-term rentals, according to the executive order from the governor, that prohibition would be in place as long as the state of emergency is in place, which as of right now, it's May 12th. So is it true that even if City Council decided today to lift those restrictions per Emergency Ordinance 2020-02, the same requirement would still be in place of any short-term rental or hotel accommodations, because we are the whole United States and the whole world, hence the word pandemic, is under a level 3 widespread community transmission. Is that correct?
That is correct. And I have to give credit to Desiree for her incredible sleuthing today, for really digging into the black and white of the governor's executive order, which is very restrictive when you read it literally. If he wants us to limit or prohibit short-term rentals or short-term accommodations from any state or municipality that is under the CDC guidelines as showing widespread problems, then yeah, that's a lot more states than just New York, New Jersey, and Connecticut.
Right.
Thank you.
Okay, wow.
It also compels us to follow those as elected officials and administrators.
Anyone else? Discussion?
I'd like to say something. So I think what needs to be driven home, at least for my support for restrictions related to COVID-19, has been driven by a concern for public health. And I would expect the same of all of the people that I'm serving with. That's for the people who live and work on the island, as well as the people who visit us and the communities where they are going to return, whether they are our low country neighbors or they're from another state. So I think we have a larger mission of public health that we're taking into consideration. We're not even just thinking about our own community, we're thinking about the impact of our decisions in terms of transmission, potential transmission. So I understand the hope that we can start to transition to something closer to normal, but I think in this regard, we need to take small steps and wait, given the information from health officials and the guidelines that the federal and state government are giving us. And I just don't think we're ready for making big changes to this equation, like allowing short-term rentals, and would support waiting to see how things are going until at least May 12th.
Thank you. Anyone else? Hearing none. So as it stands now, we are compelled by the governor's rules on what we can and what we can't do. Desiree, correct?
Yes, Mayor. So I think that Section 8 of the red line ordinance that you all have in front of you for consideration tonight would say we would still need a motion from City Council to fill in that blank.
Right.
For the end date currently. Another consideration would be to include, to make it consistent with the governor's state of emergency. Maybe we could include some language that would be inclusive of that.
Instead of, or should the governor's date change? That's a question.
Correct. I mean, if the governor lifts the restrictions prior to that, then that would make our deadline change. So you may want to just include a date of May 12th.
Or at such time the governor changes the date. But the question, Desiree, does that go in both directions? Right? It's unlikely that the governor is going to pull the May 12th date in. There is always the possibility that he'll move the date. So the question is, if you add language beyond the 12th in either direction, then are we accepting that if he changes it to May 20th, it becomes May 20th?
I would answer yes.
Okay. Then I'll make that motion and rely on you to be more eloquent than me in the wording.
The original motion was to 5/12.
I know, but now we have to add language that says, or in the event that the governor's order changes.
But we don't have to add it. We're choosing to add it.
That's correct.
Mm-hmm.
Yeah,
and City Council can certainly.
Go ahead,
yeah, sorry. I was just going to say, City Council could still meet again prior to the 12th and make any extensions it deems necessary. So that, you all still have that ability.
And Desiree, to be clear, I'm not religious on the language. I'm just making the motion to support your recommendation.
Is that you can make that as a friendly amendment rather than
a friendly amendment then.
Yeah, just for the record, I would like for the friendly amendment to be clear on the record rather than relying on me being eloquent enough to convey the message that
I was giving you all kinds of credit. Or
Mr. Mayor,
or something should change by the governor.
Mr. Mayor,
Councilmember Ward.
I think it's important to note that this is not the city administrator's recommendation. She is just quoting verbatim the governor's rules. That's what it is. That's all that it is.
And Councilmember Bell has made a motion basically mimicking everything Desiree said.
Correct, because we won't have a choice anyway.
Therefore, I don't think it's necessary to include that language in the section, section 8.
Friendly amendment.
So it's the 12th then?
Yeah.
Okay, any other discussion? And just for my point of view, we're gonna be meeting again next week, so, you know, that's just part of life. Okay, hearing none other, all those in favor signify by Nicole.
Yes, sir.
Roll call.
Councilmember Bell,
Aye.
Councilmember Smith,
Aye.
Councilmember Ward,
Aye.
Councilmember Moy,
Aye.
Councilmember Streetman,
Aye.
Councilmember Pounds,
Aye.
Councilmember Popson,
Aye.
Mayor Carroll.
Aye,
The motion passes unanimously.
thank you so much. And number 9 actually is so conducive to what we just discussed. Am I correct in saying that, Desiree?
So item 9 would include the date when new checkings and new reservations would be allowed, and some of the requirements of short-term rental property owners and short-term rental property managers that would need to comply. So this was included in the red line for discussion for City Council to determine whether those requirements are sufficient of what you all would like to have implemented, and if you all would like to include a starting date or not.
Could we say a starting date when allowed by the governor and to have these requirements in there?
Mr. Mayor.
Yes, sir.
I have no reaction specifically to the conditions set forth in this language, but we did just, I don't know if anyone from MUSC was consulted prior to this, but thinking of the offer that Dr. O'Brien made and the recommendation that we craft for every business, that we craft our policies in accordance with healthcare professionals. And if that has not been the case, then I would submit that we rework this language. We know that it's not going to be before May 12th. We know we're going to be back here. I know that they need a plan, but unless I'm missing out, I guess maybe that's my question to the Desiree, to the city administrator. If this language has been crafted with the aid of professionals.
Well said.
Yes, we did not. We used language from the ordinance that Folly Beach was considering. We included some of the requirements that were included in their ordinance. We have not reached out to MUSC yet on this. This would be part of a conversation about a reopening strategy when we are ready to start lifting those restrictions. So I don't think that it's necessary to include in this ordinance if we believe that it's not ready yet, that the language is not ready yet, and would rather do additional research and kind of study it a little bit more prior to May 12th.
Agreed.
Yep.
Agreed.
Totally agree.
I agree.
So, Desiree, we can break this out.
So
We need a motion to strike this out, or defer it until.
you don't need a motion, but you could, when you vote on the whole ordinance, you may want to include not including section 9 in the red line. That may be sufficient.
Okay, so do I hear a motion for emergency ordinance 2020-04?
Oh.
Yes, ma'am.
Yes, there are 2 blanks that are still left. Item 5 and 6. Item 5, it says the city administrator is authorized to cancel and revoke any special event permits issued prior to the date of this ordinance for events taking place until the existing ordinance has that date being April 30th. So that could be extended through May 30th. That's just a suggestion.
Motion
I hear a
to,
motion.
motion to grant the city administrator the authorization to cancel or revoke special events permits issued
Second.
prior to the day of this ordinance for events taking place until May the 30th.
Second.
Second.
Okay, I heard multiple seconds for Nicole's sake.
I said, I grabbed Councilmember Bell because he's who I heard.
Thank you very much. Any discussion on this? Hearing none. All those in favor signify by saying, well, roll call.
Councilmember Popson,
Aye.
Councilmember Pounds,
Aye.
Councilmember Streetman,
Aye.
Councilmember Smith,
Aye.
Councilmember Moy,
Aye.
Councilmember Ward,
Aye.
Councilmember Bell,
Aye.
Mayor Carroll.
Aye.
The motion passes unanimously.
Okay. Desiree, I think you said there was 2 spots that needed to be filled in.
6.
Yes, Mayor. Number 6, all public gatherings of any type, whether organized or otherwise, of greater than blank persons are prohibited. Originally, the emergency ordinance 2020-01 included prohibition on gatherings of greater than 10. That has since changed for the governor's order to 3. So that would also need to be included as part of this emergency ordinance.
Okay. Do I hear a motion?
So moved.
Wait a minute, we need a number.
3.
Second.
I'm sorry. Councilmember Pounds, second that?
Yes.
Okay. Now discussion. Do I hear any discussion on this?
Yeah, I just have a general question. What is a public gathering?
Non-family members?
Look.
A public gathering of more than 3 people?
Yeah, what I mean, that's pretty subjective.
Maybe Chief Cornett could answer that question from a law enforcement
I
perspective.
think the way I would look at that would be any planned or organized event where people are coming together in areas greater threat. The reality is a social distancing per the governor's order applies anywhere. So if they're walking the beach in groups greater than 3, then that applies and we would address it there. So it's.
Because it says or otherwise. It says organized or otherwise.
Correct. A flash mob, maybe. I guess that's organized still. I don't. Basically, we're looking at it as if there's a group of more than 3 that is not a family, then we're going to go make friends.
Okay. Any other discussion?
The language does not exclude families. Do we need to add that in there?
That was mentioned.
I'm sorry.
Otherwise, the chief's going to make friends. Any other discussion? Hearing none. All those in favor, all public gatherings of any type, whether organized or otherwise, of greater than 3 persons are prohibited. All those in favor, roll call.
Councilmember Bell,
Aye.
Councilmember Ward,
Aye.
Councilmember Moy,
I didn't hear in the motion, I didn't hear language that included family. I know that the police chief spoke to it. Just want to make sure that that's part of the language. Is that what we're voting on?
So currently the ordinance, the red line only reads all public gatherings of any type, whether organized or otherwise, of greater than 3 persons are prohibited. Council could entertain an amendment to include or exclude members of the same family who live in the same household.
Councilmember Moore, you want to make an amendment to cover that?
Yeah.
I would like to make a motion to amend to exclude families or members of a family that live in the same household.
Do I hear a second?
Second.
Okay, any discussion on that? Hearing none. All those in favor of the amendment to exclude family members?
Councilmember Bell,
Aye.
Councilmember Ward,
Aye.
Councilmember Moy,
Aye.
Councilmember Smith,
Aye.
Councilmember Streetman,
Aye.
Councilmember Pounds,
Aye.
Councilmember Popson,
Aye.
Mayor Carroll.
Aye.
Motion passes unanimously.
Now back to the original motion of all public gatherings greater than 3,
Excluding families.
including family members.
Okay.
live in the same household.
Who live in the same
That was-
household.
I think that was part of the original amendment.
Okay.
Councilmember,
Yes, ma'am.
Councilmember Popson,
Aye.
Councilmember Pounds,
Aye.
Councilmember Streetman,
Aye.
Councilmember Smith,
Aye.
Councilmember Moy,
Aye.
Councilmember Ward,
Aye.
Councilmember Bell,
Aye.
Mayor Carroll.
Aye.
Motion passed unanimously. Are you back in, Councilmember Buchanan?
You
Ryan,
On mute.
Ryan, you back in?
Yeah, it's not pertaining to my
Right, Reynolds.
refusal.
Okay, so you voted in favor of.
Yes, ma'am. Aye.
Okay.
Okay. That is the last of our agenda. Do I hear? a
Mayor?
motion? Yes, ma'am.
So just a procedural question to the city attorney. So there have been votes on each section separately. Should there be a motion to approve emergency ordinance 04, including, and I'll restate this, just for the record and for everybody's, make sure that we have the right thing on the record. The changes approved tonight include number 5, the city administrator is authorized to cancel and revoke any special event permits until May 30th. Section 6 has been amended to read all public gatherings of any type, whether organized or otherwise, of greater than 3 persons are prohibited, not including family members who live in the same household. Section 7 has been amended to include the dates, the times that the checkpoints and the access will be restricted on the island from 8 a.m. to 5 p.m. through May 12th. And it also includes an amendment to add property owners who show proof of ownership as part of the access criteria. And section 8 will read rental and use of short-term rentals, hotels, and other overnight accommodations for 29 days or less, beginning Thursday, March 20th through May 12th.
Oh, sorry.
May 12th. And section 9 is not included in that final, in the motion to approve that ordinance. And the rest remains the same as included in the red line.
Thank you very much for the clarification. Okay.
Mayor, we need a vote. We need a vote on that
Do I hear a motion?
final approved ordinance.
Do I hear a motion for the final approved motion?
So moved.
So moved.
Second.
Any discussion? All right.
Yeah.
Roll call.
Jimmy, I have the one question I had before. Because we have voted individually on these, and it does back to you and Julia, I remain opposed to changing the hours, which would force, if I wanted to remain opposed, force a vote on an overall ordinance that I support. So I don't understand procedurally why we would vote again on this in total if any one of us is that adamantly opposed to changing the hours.
And I have the same issue because we voted on certain sections of the emergency order, but I can't vote on the whole thing because it incorporates part of the short-term rental program that I had to recuse myself from.
Correct.
Legal.
What do you recommend, Julia?
Jeez Louise. Well, the fact that no other provisions of the ordinance have changed other than the ones that we have voted on, I think we're safe with how we have it on the record right now.
Okay.
Vote. So I think we're okay, rather than creating confusion by trying to adopt the ordinance as a whole.
I withdraw my motion.
Okay.
Okay.
This Councilmember Ward, you withdraw your second?
Yes.
Thank you.
I believe that ends our agenda. Do I hear a motion?
Wait,
We got,
Oh, next meeting, just in case. Yes, Councilmember Smith.
were we going to review plans for the rec center? Is that not on the agenda?
Oh, no, I'm sorry, we're going back to number 2, which is the discussion of a phased reopening strategy and plan for the city of Isle of Palms.
Thanks.
Desiree, you want to go over some of the aspects of that?
Jesus.
I don't think he's a member right this.
Sorry.
He is, I take that back.
Yes, we distributed, and oh, here it is. We have distributed to all of council some considerations for you all to discuss and ponder upon related to a phased reopening of the island. We have since made additional changes, and of course, this is going to be a working document and a fluid document, at least for the next few days and maybe a few weeks. But we included some not recommendations, just some considerations for city council related to the beach and community access restrictions. You know, what are some of the reasons or ways that we could start looking at or lifting some of the restrictions? And I think that city council has discussed that as part of this emergency ordinance that was approved. We have also included some considerations related to the use of the recreation center. And based on some, guidance from the CDC, guidance from the South Carolina Parks and Recreation Association, guidance from several public policy think tanks and public health schools, we have developed some of those talking points for city council to consider. For the recreation center, one of the things that we included was, as part of phase 1, the reopening of some of the outdoor green spaces, including the tennis courts and the soccer field, the Bark Park, and the multi-purpose field. Some specific restrictions for the use of those, of course, making sure that people are maintaining social and physical distance. And the reason we included those as part of phase 1 is because it allows the staff's ability to provide constant monitoring of these areas, which is one of the considerations that experts are making sure that staff monitoring and in charge of managing those restrictions are able to do. So I think that's what Councilmember Smith wants to discuss, particular to the rec center, and we have our recreation director, Norma Jean, on this here virtually.
Councilmember Smith.
So would you need a vote or guidance from us on when to start that, initiate the phased approach to the rec center, is one question.
Yes, currently we have closed all the facilities according to the state of emergency. I think that there are a group of residents that would like for the city to reopen some of these spaces. And as just being responsive to the community and those requests, we have included some of the considerations for city council to use to determine, is it time to start lifting some of those restrictions, or would council want to delay action, for a couple more weeks? We are seeking guidance, particularly with the rec center.
Mr. Mayor, if I may, real quick, have the floor. I would go ask the recreation director, Norma Jean, where you guys are in staffing, because I know some are not all there. What would it take, and how many would it take to be in place, and how quick could we get those people in place? Obviously, we're looking at times from, I think it was 8 to 5 or something like that, to have those folks on staff, or get those folks back on staff, working the rec center and controlling our 3 or less, mandate that we just voted on.
Jimmy, if I may add to that.
Let's let Norma Jean answer that one first, please.
Okay.
Okay. We can monitor that with our existing staff. We'll take turns. We'll, somebody will be outside the entire time watching this. I think this is a good time too, because right now the island is restricted who can come on and who can go off. So the majority of the people that would be on the grounds would be Isle of Palms residents. So this would be a good time for us to see how this is going to work. And if it works well, then maybe we could open something else, another passive area. But I
My-
think,
Yeah, my question was how quickly can you do that? How quickly can we institute or get moving and open? If we say we want Mount Pleasant's opening up their grounds on Friday, if we say, hey, let's go ahead, we're gonna open up our grounds on Friday, is it possible?
absolutely.
Perfect. Okay.
Just one
Yes,
point.
yes, ma'am.
As part of the considerations that we submitted to city council included that as part of phase one, which would reopen some of the outdoor facilities that I mentioned earlier between Monday through Friday, from Monday through Friday between 8 a.m. and 5 p.m. And this would allow staff to monitor that people who are using it are following social distancing. I think that starting there makes sense because we do have staff, on the grounds already. So I would like to make sure that it is understood that it would be during those times of the day and those days of the week.
Thank you. Councilmember Bell.
I'm clearly not opposed to the grounds being open, just to be clear. But when I go back to what we just voted on, all public gatherings of any type, whether organized or otherwise, of greater than 3 people. So that basically says 3 people, now you add staff into the mix. We've just violated what we just voted on. It doesn't talk about distancing, it talks about activities organized or otherwise. And that is a public facility. So I don't understand, certainly until May 12th, how we can go down a road of inconsistency. And by the way, I mean, this falls on Chief Cornett for enforcement again, which is more expense. If the goal is to open up the grounds and say, we've got a wonderful green space that people can walk and exercise and comply, that's fine. But when you start mixing, it doesn't distinguish between employees, non-employees, families, not families. It's another onus on public safety and the city for something that we just voted and said we can't do.
Councilmember Bell, I'm sorry, Councilmember Smith.
Well, I think that there has to be some common sense in this, and
It's either there or not.
Wait a minute, let him finish.
I have the stage or whatever.
Sure.
I have the monitor. How do you say that? As far as common sense, we're talking about on the beach, we're talking about groups of 3. Similarly, the rec center is a wide open space that I don't think you would say everybody, a gathering, you wouldn't measure the number of people on the entire rec center space to gauge how many people could be on the grounds. So in that regard, by common sense, I mean, you're going to have to take sections of that, which is what I think the rec staff has done. And thanks to the staff for the work that they put into this document. So if we're restricting how many people can use a certain facility to 3, that makes sense to me. And I think we follow, the lead of Mount Pleasant, which is opening up its parks and facilities. Plus, we have the advantage of having a controlled population for most of the day that Mount Pleasant doesn't have. So as Norma Jean pointed out, we have the constraints of how many people are coming on and off the island, so that we have a population that is going to be mostly residents, and that population is also shown not to have a very low number of COVID cases. So I think that overall this is a smart plan. I hope that it includes smart use of the basketball goals to just 3 people at a time, similar to what we're talking about for the other facilities.
Thank you. Councilmember Bell. Okay.
No, that's fine. I just, I would ask the chief to weigh in on clarity and enforcement. I don't think it's for us to speculate on what constitutes a public gathering. If I look at a basketball court, it's a relatively small area, and anyone can make that argument in a relatively small area. So,
Yeah, basketball courts are in phase 4 though, so it's not in this phase 1. Just for point.
I would like for us to be consistent. That's all I'm asking. And I think, you know, this is a subject that's going to take a lot of work over a longer period of time. And, you know, I don't think we're there yet.
Mr. Mayor.
Administrator Fragasso.
Oh, I think Councilmember Moy had.
I'm sorry. I look at one thing. Councilmember Moy. Please
Thank you, Mr.
excuse me
Mayor.
for not seeing you raise your arm.
Not at all. I think if we're gonna be consistent, we've been seeking advice of medical professionals, specifically Dr. O'Brien, and each of the items in phase one, I believe Department Head Norma Jean asked him about, and his reaction was pretty clear that the policies as recommended by our Department of Recreation and our city administrator are what he considered to be safe and appropriate at this level of where we are as a community. And I agree. We have to, you know, we have the recreation staff that can monitor, they can enforce. That's where the chief comes in. So I hate to always put you on the spot, chief, but unfortunately, everything that we're doing falls on you. I know Norma Jean's staff is going to be a huge help, but can you at least provide? Can you please, both of you, or maybe just you, chief, chime in to, you know, where we keep adding, the things do keep adding up, and I do see we're piling on additional enforcement responsibilities for your team. So as each as an individual seems feasible, let's take stock of everything that we're asking you to do.
So I think Norma Jean and I have a very close relationship, and her staff has been phenomenal at ensuring when there are issues that they're calling us. And we've been comfortable with them monitoring as best they can. And they know when it gets to a point that they need us. And to be honest, the other places that we're addressing the keep moving or the checkpoint, we're bringing in additional resources for those or scheduling them specifically for that. And that has freed up our patrol officers to be able to respond to calls, which means if Norma Jean's staff had an issue where somebody was not listening or was violating the social distancing or any of the other ordinances, she would call our staff and we would be able to come from the officers that are on patrol, come to address that issue. I don't think that's going to be hard because I think they're going to listen. And at the end of the day, if it turns into an issue, Norma Jean and I will have a discussion and come back to you and say, hey, this isn't working and we need to shut it down.
Okay. Councilman Speaker.
You call on me, Mayor?
Yes, sir, I did.
Yes, okay. Just one question and observation. I know we have the limitations like singles for the tennis court and then, you know, no more than 3 on the soccer field, that sort of thing. Now we know we're going to have quite a demand. When you open it up again, there's going to be quite a demand. You're going to have people want to go out and play tennis. And so has there been any thought given to what we do for people who are waiting to play tennis? Would there be a limitation on how long a singles match could go on before they would have to leave and someone else could come in after it's disinfected? You know, so I could foresee that we're going to have a lot of people want to have use of the facilities, whether it's basketball, tennis, soccer, or whatever. And, you know, there's going to be some disappointment if we don't have some planning behind that. Maybe that's a question for Norma Jean.
Yes.
We do have plans in place. Tennis is limited to an hour. We're going to turn everything over every hour so we can clean the gate handles. Same with the dog park. There are only going to be 3 people allowed in the dog park at a time. And we're going to turn it over every hour so that the next group can go in if that's necessary. It may not be necessary. Exactly. There's also will be speculations. We'll have rules posted at all these areas where they can't gather while they're waiting. They can't gather in groups. They have to spread themselves out. They have to social distance while they're waiting to use those facilities. So I think we've got a good handle on it. We have our rules in place. As the city administrator mentioned to you, I've been meeting with all the recreation directors all over the state of South Carolina and all the local ones, the regional ones, and we've talked about this for weeks. And I think we all have a pretty good handle on what the rules and regulations should be. And we will certainly adhere to the governor's orders as well as listen to DHEC and CDC. And I don't anticipate needing the chief's help, but obviously if we do need, we will call him. But I don't think we're going to have an issue. I think we've got a handle on this.
Administrator Fragasso.
Yes, two things. One is the use of the basketball court is not included in phase one. And the reason for that is the contact sport is still not recommended at this phase. I know that there were some feedback from the community and Chair Smith about allowing, and I don't play basketball, so it just shooting balls to the net. allow 3 people to do that. So I just want to make sure that you all have a chance to discuss that, because it's not included in our phased criteria.
Okay, let me work down the list that I saw the hand go up. Council Member Popson.
Yeah, thank you, Mr. Mayor. I just want clarification. Did I hear the administrator and Norma Jean say that we're going to be staffed Monday through Friday, 8 to 5? And if that's the case, what are we going to do after 5 o'clock and on the weekends? Because you know people are going to keep coming out there.
Norma Jean, do you want to answer that?
We'll continue to do what we've done now. We've put signs out, and actually people have been pretty compliant. I think when we first started, the chief had to shove some people out of there, but people have been absolutely compliant here recently. So I think we'll be okay.
I will say, I think that this is, we all have to agree that if this gets out of control and people do not comply, then we should be, we would be in a position to quickly scale back some of these restrictions, or implement again some of these restrictions.
Thank you. Councilmember Pounds.
Thank you. Yeah, a couple of things. I would say, if Norma Jean and crew has come up with phase one, then I'm totally in agreement with that, but nothing more. I mean, I'd love to back up personally and revisit the beach being for exercise only. Chief, I heard your comment earlier that there was much more patrolling today, but this weekend that was absolutely not the case. I mean, there was a lot of people sitting from where I was, and there were police on the beach that didn't stop anywhere except one group of about 12. So if we're going to have the rule, let's enforce it. If we're not, then let's take it off the books, in my opinion.
Thank you.
That's beach sitting specifically.
Councilmember Smith.
Thank you, Mr. Mayor. And okay, as far as basketball, it is very possible to use a basketball hoop without contacting other people in terms of shooting baskets, especially with the small group of 2 or 3 or 1. And for example, playing a game of horse, you can be definitely not close to each other, and it's different obviously than playing in a large group, and I can see why that particular use of the basketball court should be much later. But currently we're listing use of the basketball hoops in phase 4, where in comparison, our neighbors in Mount Pleasant are letting it happen immediately along with their other easing of restrictions. So it just should be, it's very easy to explain the parameters of using the basketball goals. Not everybody has a basketball hoop at their house. We are fortunate that we do, and I still have 2 users who would really like to have a good basketball hoop that they could use. If you wanted to restrict it to just family, you could do that, but it just, if we're going to allow tennis and soccer, there's no reason why we shouldn't be able to utilize the basketball courts, which, and I think it's very doable. The basketball court is right next to the tennis court, so that if somebody's monitoring, they could easily, keep track of both.
Director Page.
I would like a little more time to look at that. I will tell you that the recreation director in Mount Pleasant did not recommend this. We all were in agreement that this should be later in the phase, because it's really going to be a little bit difficult to police as popular as our basketball courts are. We need to decide what kind of time restraints we put on that. Do we tell somebody they can, because their role of Mount Pleasant is individual. So it would be one person with how many people waiting to shoot. So I need some better parameters before I go there. If you'll give me that liberty of working on that and how we would police that and what regulations we put in place.
Thank you. Yes, ma'am. Councilmember Smith.
My understanding is that the Mount Pleasant, from a Mount Pleasant council person, was that there was an allowance of 3 people for using the basket.
Director Fregasso.
Um,
Administrator, I'm sorry, it's getting late.
It's 8:30, I get that.
Sorry.
So just one comment that I'd like Director Page to chime on is, when do we implement this? Again, we're all looking for the right trigger to open up the outdoor green spaces. You know, we want to ensure that we have proper signage. We're in the process of acquiring that. So is May 4th, Monday, May 4th of the right date? Is that something that council wants to do, or sooner rather than later? I guess from an operational standpoint, how ready are we to have everything in place to safely promote the rules, to make sure that people understand before they come to the rec what the rules are, and have a good communication strategy to ensure that?
Well, a safe space would give me till Monday. I have some signs made up that we've made up and we can put together and get out there to get started. So tomorrow would be too soon. So I'm thinking maybe Monday might be a good starting point, and we can go out on social media and let folks know what the parameters are. And so it's
Thank you.
The wish of council. We'll make it happen when you say.
Thank you. Desiree, anything else we want to talk about as for our phased opening?
No, Mayor.
I do have one suggestion is, do we want to start with our committee meetings? Because we got a city that's been dormant. And we've got a lot of projects out there. And again, this would be, Zoom meetings. But I do think we've got a lot of things that need to be discussed. That's part of my looking at a phased opening, is trying to get us back into order again.
Agreed, Mr. Mayor. We have a lot to do.
I agree.
Shaking the heads.
Yeah. Yes.
Yeah, Mayor, we could certainly start scheduling meetings for May, virtual meetings for May. I will say, I would ask for a lot of patience for staff, because, I have been focused on the COVID-19 pandemic for the past 54 days, even longer internally. So there, a lot of things were put in pause as a result of this situation, and particularly, all department heads have been focused on COVID-19. So we could certainly, reignite some of these discussions. However, I just want to put it out there. A lot has been put in pause just because of this situation. So I'm eager to get some normalcy back in the city and in city business, but I do ask for some patience.
Can you tell us what works? And Jimmy, just have her come back with, we don't want to overburden any of the city staff.
Well, according to the regular schedule, we would start meetings on Monday with public safety, which would mean that agendas and meeting packets would have to be done by this Friday. So if we could maybe shift all of those committee meetings to the second week of May.
Yeah.
That would give us some time to be able to put all the paperwork together.
Absolutely. You need all the time in the world. We need to work with you, and we need not to overburden with micro stuff.
Thank you, Jim.
So anybody else? Councilmember Smith, I see you raise your hand.
Well, I was just going to say, maybe there's some committees that might need to have more urgency to meet than others. That maybe some of the committees might skip May and meet in June. But you could discuss that with the individual chairs, I would think.
Okay. Anything else? Do I hear a motion? However, do we need to meet again next week?
Do we need to make a motion? Did we?
No, let's just discuss next week. Do we need to have another Zoom meeting, council meeting, and, or not?
Mr. Mayor, why not wait till the next one on the 13th?
Okay, I'm good with that. Unless something else comes up that we need to know.
Then
Well,
we can adjust.
We need to meet at least by the 12th.
Yeah,
Mhm.
got to do that.
Okay. So,
Mayor?
we ought to take a day to digest what we get on the 12th. You think?
Well, the governor will probably make an announcement on Monday, the 11th, so we could follow up with a meeting on
Oh.
Tuesday.
12th would be good. Do
We
we
could
want
do
to,
that.
how about a time? Is
That's-
6 good?
Up to you all.
Yes, 6.
Flexible.
Mayor,
Flexible.
Yes, ma'am.
before you adjourn, we do need a motion to implement phase 1 of the reopening plan for the recreation center, which would include opening the outdoor fields as presented by May 4th.
Do I hear a motion?
I would like to make that motion and add that we look at how we can include the basketball courts in a safe way.
And I think I saw Council Member Buchanan second that. Any discussion? Hearing none, all in favor?
Hang on, Mayor.
I'm not sure what the basketball,
Yeah,
I'm not sure what that means.
That we include use of the basketball courts
I
within
think we
phase
table that
1.
conversation to Norma Jean's comment. I don't think we make it part of this motion personally.
Can I
Councilmember
not,
Pop-
if I'm the person that's making the motion, can I not include that as part of my motion?
It's a risk.
So,
I would say if somebody wants to make a motion to amend my motion to not include the basketball courts,
First off, you have to have a second to the motion.
well, I'm
She
trying
has-
to clearly
Councilman-
state my motion.
Well, Councilmember Buchanan, you're on mute, but I see you said you seconded it.
no, this is not vacation rentals.
No, I understand. I did second the motion, but then Councilmember Smith came up with the basketball court thing
Oh,
after that.
sorry.
Yeah. The motion was to start with phase 1, and I think that's a good idea. While I do believe that, I mean, as long as people are on the basketball court abiding by the governor's regulations of 3 or less, I don't see a problem. If Norma Jean needs a little bit more time to implement that and get those things in place, I can see that as well. Our staff is already stressed out, and we need to find ways to make things happen, and we can roll this out. I mean, if we need to, perhaps, I mean, Norma Jean, if we can move it up forward, once you figure out how everything's moving, then once the recreation committee meets, within the next week or so, then maybe they can make that recommendation to go ahead and move forward with expanding, the recreation facility or the programming there.
Good comments. Anybody else?
What is the motion?
Good question.
The motion is to move forward with opening phase 1 of the recreation department.
That's not the original motion.
That's not Susan's motion.
Including the basketball courts.
Well,
So
That's,
does
Okay.
anybody, if somebody wants to second that?
Does that
Wait a
include
minute.
May
I'm
4th?
just asking, what is the motion? It's just really simple.
The
What's the
motion is to move forward with phase 1, adding in use of the basketball courts as our recreation director advised. Well, okay, I'd scratch that. Adding in use of the basketball courts, period.
Is there a date, Councilmember Smith, included in your amendment, in your motion?
That I think we were talking about, what was it?
May 4th?
Monday, whatever
4th.
Monday, May 4th, which gives us 6 days to figure out the basketball courts.
Mr. Mayor, let's call for the question.
Well, there is a motion, and I haven't heard a second yet.
It was a second.
This is a second.
Okay.
Okay.
You're going to
I
call
have
the question?
All right. All right, so discussion, Councilmember Moy.
Does Norma Jean, how do you feel about 6 days?
You know, I'm not sure how we're going to police the courts.
Yeah.
Because basketball is a contact sport. It's going to be difficult, I'm afraid, to limit the number of people. Mount Pleasant has, on their rules, they have individual. So it's one person on the court at a time, or if it's a father-son, they could be on the court at a time. So if we implement those rules, then, you know, I guess we can try to make that happen. I think there are going to be a lot of people there wanting to use. I can see the basketball courts as a bigger challenge than the rest of the facilities right now.
I'd like to make an amendment to the motion, and that is to delete the basketball portion of it.
Second.
We have a second. Discussion.
Yeah, Jimmy,
Yes, sir.
I can support phase one. I can't support it with the basketball courts, and just would advise that the danger in putting it forward with the basketball is that the entire motion fails. So,
That's what I was doing, is taking out the basketball.
no, yeah.
Any other discussion on taking out the basketball on amendment? All
I-
those,
I mean, I disagree.
okay.
No surprise.
Okay, any other discussion on the amendment? All those in favor of taking out the basketball portion of the original motion, roll call, please.
Councilmember Popson,
Aye.
Councilmember Pounds,
Aye.
Councilmember Streetman,
Aye.
Councilmember Smith,
Nay.
Councilmember Moy,
Aye.
Councilmember Ward,
Nay.
Councilmember Bell.
Wait a minute. Wait. No. I got it wrong. Aye.
Okay. All right. Gotcha.
We're taking out the basketball, right?
Yes, sir.
Okay.
Councilmember
Thank
Bell.
you.
Okay.
Aye.
Councilmember Buchanan,
Nay.
the motion to remove them passes.
Left the mayor.
I'm sorry, Mayor Carroll.
Aye.
The motion passes to remove basketball from the phased reopening, passes 7-2.
Okay, now back to the original motion of phase two, reopening of the rec center,
Phase one,
phase one. Roll call
On
vote.
May the 4th, correct?
On May 4th.
That's correct.
Councilmember Buchanan,
Aye.
Councilmember Bell,
Aye.
Councilmember Ward,
Aye.
Councilmember Moy,
Aye.
Councilmember Smith.
Aye.
Councilmember Streetman,
Aye.
Councilmember Pounds,
Aye.
Councilmember Popson,
Aye.
Mayor Carroll.
Aye.
Motion passes unanimously.
Thank you very much. Desiree, is there anything else we need to discuss?
I don't think so, Mayor.
Do I hear a motion from a certain person?
Motion to adjourn.
Second.
All in favor?
Aye.
Aye.
Off record at 8:30.
Have a good night. Thank you.
Good
Thank you
night.
all.